Hi, I'm Vivian Williams with headlines from the Mayo Clinic News Network. Using the measles virus to kill cancer. It's called Virotherapy. Mayo Clinic researchers have shown that virotherapy can be effective against the deadly cancer multiple myeloma. The virus infects and kills the cancer, but spares normal tissue. 2 patients in this study who did not have good results from other treatment each got a single high dose of the measles virus. One patient experienced complete remission after she'd been battling myeloma for years. Multiple myeloma is a cancer of plasma cells in the bone marrow. It usually responds to treatment, but eventually overcomes strategies and is rarely cured. Virotherapy offers new hope. In other news, concussions. They can happen to athletes on any playing surface. Mayo Clinic researchers have developed a rapid, easy-to-use eye movement test that screens for concussions on the sidelines for youth sports. In a study, the researchers assessed what's called the King-Devic test. The test requires an athlete to read single-digit numbers on cards. Then, if an athlete suspected of having a concussion, he or she is given the test, which takes about 2 minutes, and the results are compared to a baseline test taken previously. If the time needed to complete the test takes longer than the baseline test time, the athlete should be removed from play until evaluated by a medical professional. Here's Dr. Amal Starling.
We need to make sure that we have a good way on the sideline, on the bench, wherever the sport is being played, to have a sideline tool that we can use for removing people from play after a suspected concussion.
They're helping youth players stay safe. And here's a spring and summer health issue we all need to know about: Lyme disease. It's the most common tick-borne illness in North America, and it's carried by deer ticks, which can spread the bacteria when they feed on the blood of animals and humans. You're more likely to get Lyme disease if you're in grassy areas or the woods. The good news, it can be treated with antibiotics, and the sooner you get treated after getting infected, the better. What are the symptoms of Lyme disease? Well, they're varied, and they usually happen after a month of the bite, and they include a rash that expands into what looks like a bullseye and flu-like symptoms: fever, chills, fatigue, and a headache. Later symptoms include joint pain, especially in the knees, and neurologic symptoms, such as muscle weakness or temporary paralysis on one side of your face. So if you're in grassy or wooded areas, check for ticks, and if you get a bite, contact your healthcare professional for advice. And that's a look at headlines from the Mayo Clinic News Network. I'm Vivian Williams.